are still responsible for paying unpaid amounts to landlords, but those unpaid amounts cannot be the basis for an eviction. Landlords may begin to recover this debt on March 1st, 2021, and small claims court jurisdiction is temporarily expanded to allow landlords to recover these amounts. Landlords who do not follow the court evictions process will face increased penalties under the new law. The County of Santa Barbara is also offering emergency rental assistance to residents who are experiencing financial hardship caused by the COVID-19 pandemic. The county's $2 million COVID-19 emergency rental assistance program is now open and accepting applications. Eligible County of Santa Barbara residents living in the unincorporated areas of the county who have experienced a loss of income due to the COVID-19 pandemic and can demonstrate the need for rental support may apply for financial help to pay the rent that is due. The county's rental assistance program is being administered by United Way of Santa Barbara County. If you have suffered a loss of income or increased expenses caused by COVID-19, you may be eligible for up to $1,000 in monthly rental assistance for up to 3 months. Payments will be made directly to the landlord or property management company. And if you need help paying your rent, please call 805-965-8591 or email info@unitedwaysb.org. That's info@unitedwaysb.org. Labor Day is the one day a year we take time to honor and value the dignity of work. Labor Day is dedicated to the social and economic achievements of American workers. It constitutes a yearly national tribute to the contributions workers have made to the strength, prosperity, and well-being of our country. This Labor Day, I hope we can all reflect on the contributions essential workers have quietly and selflessly made during the coronavirus pandemic. The farm workers, truck drivers, warehouse workers, grocery clerks, and others who are keeping food on the shelves in our market. The frontline healthcare workers, the nurses, EMTs, doctors, and others in our hospitals, nursing homes, and home health care who continue to risk their own lives to save lives. The public safety employees, the police officers, deputy sheriffs, firefighters, and emergency dispatchers who work around-the-clock shifts and on every holiday to respond to emergencies and help keep us safe. Essential workers are working long hours under intense stress with little time to recover from physical, mental, and emotional exhaustion. Like so many of us, they are also balancing the needs of families and friends under difficult financial circumstances, but they are continuing to go to work each and every day to make sure the rest of us have what we need and are safe. Please take a moment to say thank you to the essential workers you meet in the next few weeks. They don't do their jobs for recognition or thanks. They do their work because they know it's important. It's more than important. It's critical to keeping our economy and society functioning. Recognizing and respecting the value of work is the best way to celebrate Labor Day this year. Next, we have Dr. Vonda Reynoso, Director of the county's Department of Public Health.
Great. Thank you, Supervisor Hart. Today, we are reporting 64 new cases. We currently have 224 cases that are still infectious in our community. Currently, 39 people are hospitalized with 16 in the ICU. Our total case count stands at 8,361 today. We continue to do rigorous contact tracing and are connecting with positive cases and their contacts in less time than the standard of 24 hours. Of the cases and contacts with closed investigations, the average resolution time is 1.85 days and 2.19 days respectively. The average resolution time, regardless of the case or contact status, is 2.02. Information from contact tracing indicates that social gatherings continue to be an issue in our community. For the month of August, we are seeing a wide range of gatherings, such as those at beaches, lakes, rivers, birthday parties, family events, funeral, restaurant, bar, travel, and other social events. We encourage everyone in our community to limit the gathering of those outside your household. On another note, I'm happy to share that Santa Barbara County officially launched the Housing for the Harvest program on Monday. We are the first in Southern California to roll out a Housing for the Harvest program, which will increase access to isolation and quarantine housing and wraparound services for farm workers and food processing workers who have tested positive for COVID-19 or been exposed to it. This project is a great example of our collaboration with community partners. Family Services Agency will be coordinating the wraparound services, including transportation, meals, and wellness checks for our Housing for the Harvest program. We thank them for their extraordinary partnership in this new venture. This effort highlights our county's commitment to address the disproportionate number of farm workers and food service workers impacted by COVID-19. In addition to our collaboration with Family Services Agency, we have had a rich partnership throughout this pandemic response with a variety of community services-based organizations. Public Health has committed funding to these trusted community partners for much-needed services, including outreach and education, PPEs, and language access services. I want to thank the partners in the Latinx and Migrant COVID-19 Response Task Force for all your hard work and commitment to ensuring that members of our community are getting access to needed services during this unprecedented time. In closing, I want to thank you, everyone, for doing your part to keep our community safe. Everyone benefits when we wear our face covering, when we maintain physical distance, and when our weekend activities do not include gathering with people from outside our household. Thank you.
Thank you, Dr. Del Reynoso. Dr. Henning Ansorg, the county's public health officer, is also here today.
Good afternoon, everyone. I would like to give an update on our activities to address the rising COVID cases in Isla Vista. The Public Health Department is taking a proactive approach to reduce the viral transmission in that area by taking the following actions. We are collaborating with the university, student health clinics, as well as community partner organizations to help students and other community members in Isla Vista reduce their risk for contracting and spreading COVID. We are working on programs to substantially increase local testing, which will identify asymptomatic spreaders that can subsequently quickly isolate. Our testing site at the Goleta Community Center has been up and running since Monday and is easily accessible from Isla Vista. The testing is available even for persons without symptoms and is free of charge. We are working with outreach ambassadors, the Sheriff's Office, as well as student and community groups on education on prevention of COVID-19, and we are providing hotel rooms for safe isolation and quarantine for infected individuals and their contacts if needed. Regarding schools and childcare, we are very pleased to report that as of today, 4 of the initial waiver applications have been approved by the state. These schools are Howard, Knox, Waldorf, and Laguna Blanca schools. We want to congratulate these to their successful application. These schools have been notified, and they are now allowed to open as soon as September 8th. We have received a total of 20 applications for waivers and are expecting additional approvals early next week. Over the last several weeks, our team of physicians, epidemiologists, health educators, and communication staff has worked alongside our educational partners to help them be successful in safely reopening amidst the pandemic. As an example, we have conducted 2 extensive training webinars for school districts and private schools in conjunction with the Office of Education on safe operations of schools. We are actively providing assistance to schools to set up their own testing routine with labs directly or through already existing testing sites. We have a team of experts, including a pediatrician, a public health specialist, and health educator, as well as a liaison to the school districts and child care centers to help address all remaining questions regarding the safe reopening of schools, as well as child care cohorts. We have expanded our experienced disease control team and contact tracing team who are able to quickly respond to any potential COVID outbreak at schools. Child care facilities, as well as in-person instruction groups for children requiring special education, are receiving ongoing guidance on safe operations from us as well. The well-being of our children and youth are of utmost importance to us at the Public Health Department. In order for all educational institutions to be able to open up safely for in-person instruction, we need to reduce our daily case rates further. We have been successful in doing so, and I urge everyone to continue with our safety measures. We do owe this to our children and youth. Thank you for your cooperation.
Thank you, Dr. Anzorg. Suzanne Grimacy is also here today from the County Department of Behavioral Wellness to share her valuable insights on community wellness.
Thank you, Supervisor Hart. I would like to speak today about community resiliency. All of us have spent the last 6 months living our lives with COVID-19. Nearly 80% of the 2020 year has so far been spent regularly dealing with the ongoing changes related to the pandemic. Everyone has had to make life-altering changes to our schedules, the way we work, go to school, and even engage with our extended families. All of this comes on the heels of significant events that have caused a great deal of stress and change, including the Thomas Fire, the 1/9 debris flow and loss of 23 lives, the Holiday Fire, and through all of these events, we've learned the impact of what a planned power outage is and how to make it through. A year ago Wednesday, 34 lives who were aboard the Conception dive boat were lost. If we go back just a few more years, we've had multiple wildfires, a major oil spill, and other mass casualty events. Wednesday's anniversary date of the Conception dive boat fire was a day filled with memories, mourning, and yet a reminder of just how strong we are as a community. First responders, many families of those lost on the Conception, helping agencies and community came together to remember the day. This is an amazing example of community resiliency. So what exactly is resiliency? Resiliency is the process of adapting well in the face of adversity, trauma, tragedy, or other significant sources of stress. Resiliency is the ability to know how to navigate resources and the capacity to bounce back. Relationships that are built through hard times can be exceptionally resilient and even continue when a new normal begins, perhaps as is the case living with COVID. These relationships may even help us to more effectively rise to the occasion when the next crisis occurs, as we know that it will. So what does a resilient community look like? A resilient community can respond to a crisis in ways that strengthen its bonds, strengthen the resources available within the community, and strengthen a community's capacity to cope. Community resilience is the individual and collective ability to respond to adversity and change. There are 5 key factors that allow us as individuals and as a community to bounce back from disasters, trauma, tragedy, and stress. These are: 1, caring and support; 2, high expectations for success. In other words, knowing that we can make it through. 3, opportunities for meaningful participation. 4, positive bonds, those relationships that are built during the difficult times. And 5, the ability to adapt. We are a resilient community. This is especially important to tap into at this time as we continue our marathon of living life within a pandemic, with so many uncertainties and unpredictable changes. Resilient people and communities can still get tired, and I know many of us are feeling that way now. Not just tired, but exhausted, worn out from the daily vigilance to practice safety guidelines, to deal with unexpected financial impacts, working and helping our kids through school at home, and the extra emotional work it takes to find a new way to live, to find a new life in a new way. At the end of the day, I think most of us want to close our day feeling inspired and fueled by a day of engagement in purposeful work or activities. While working hard to remain passionately engaged in purposeful work is preferred to monotony and boring activities, it can be a recipe for burnout. A reminder to us all, take breaks, carve out time for self-care and re-energizing, get outdoors, move your bodies, live in the moment rather than trying to figure out and worry about what is next. Also, say hi to your neighbor that you've not met before. Ask a store clerk how their day has gone. Talk to people when you're waiting in line, even if you're 6 feet apart. Communities with connected people are simply more resilient. This is a fact. And our community resiliency is needed for times just like this. Please enjoy the long weekend. Take care. And if you're out enjoying the fresh air at the harbor this weekend, stop by the new memorial for the lives lost on the Conception, located at the end of the breakwater. It's an excellent way to stop and reflect on how precious life and relationships are. Thank you.
Thank you, Ms. Grimacy. We'll now go to questions from the room. Mr. Devine?
Today's school, obviously those 4 schools were approved by the state to begin in-person instruction. When could we see those schools open?
September 8th.
September 8th, so all 4 will open on September 8th?
I don't know, that's up to the school, but they're allowed to open.
And then what is the status of the other 16 waiver applications? Were any of them rejected or are all of them pending?
None have been rejected, 4 have been forwarded to CDPH, and we are awaiting their approval.
And then you guys are dealing with the other 12?
Correct.
Okay. And then how did keeping the beaches closed on 4th of July weekend lead to the decision to yet again close the beaches for Labor Day weekend?
Well, I think the experience that we had over Labor Day was very successful, and it informed the decision to make the beaches closed this weekend. Although I shouldn't be using that word because the beaches are actually not closed. Activities are restricted. Beaches are still accessible to the public for active recreation. You can go in the water, you can walk along the beach, you just can't sit and be stationary and gather in groups.
As far as sheer numbers go, what was the success from 4th of July predicted, what it would have been if the beaches were open as opposed to what ended up happening?
Well, it's really impossible to predict, what would have happened, but as we did not have crowds, it was not a problem. The police and park rangers that were patrolling the beach reported that it was very successful. People were compliant, and we expect the same thing to happen this weekend. There will be sheriff's deputies and park rangers and city staff in Carpinteria and in Santa Barbara out looking at the beaches and making sure everybody's doing what they're supposed to do.
And then obviously a lot of people saw the images of Isla Vista parties last week. What is going to prevent that from taking place throughout this holiday weekend?
Well, there's been a lot of messaging to everybody in the community and to Isla Vista in particular. We're working, as Dr. Anzorg said, very closely with the University of California, Santa Barbara. The Isla Vista Community Services District, Public Health Department are all actively messaging to residents of Isla Vista and every part of the county that this challenge is not isolated just to Isla Vista. This is a really popular weekend when many people would be tempted to gather, and we really have to emphasize every single part of the county. Gatherings need to be discouraged. There were upticks previous holiday weekends despite beach closures that were a challenge, and we need to avoid that right now. We're in a great moment when the cases are trending down and the potential for opening new businesses and in more schools is right on the edge. And in order to maintain that opportunity, we have to have sustained commitment, and the temptation to gather with even just a couple of friends this weekend needs to be avoided.
Lastly, for me, Labor Day weekend, temperatures are expected to be about 10 to 20 degrees higher than average. What precautions should people take?
Be smart, plan ahead, stay cool by staying indoors as much as possible, limit your physical activities, stay hydrated, make sure your pets are hydrated, and just, lower your activity level and your expectations for outdoor recreation in the hot parts of the day, and try and seek shade and stay cool.
Thank you.
Next, we'll go to questions on the phone.
Yes, first up is Josh Molina with Newshawk, to be followed by Laura Place at Santa Maria Times.
Yes, I noticed that 2 days ago we had 66 cases, yesterday 71, I think today 63. What does this mean, or does this do anything at all in terms of the goal of moving from the purple zone to the red zone? I know that in the best case scenario, there was a credit given toward the end of August and then a couple of weeks into September. Maybe we could transition into that zone, but I guess I want to see, does this jeopardize this, or how many more days can we see cases with these high numbers before it does?
So on September 8th, CDPH will be releasing our county's tier assignment. That September 8th tier assignment is based on the data from August 23rd to August 29th. And so there is a 7-day lag always in the calculations. I think that we can say that although our county's case rates are decreasing, but it's not decreasing sufficiently. So 32 new cases per day should be our yardstick we should be committed and do everything that we can, including not gatherings, including wearing our face covering, maintaining physical distancing, staying home when we are sick in order to get there.
So it's not likely that we're going to move from purple to red on September 8th or really any time after that if the data they're using is back in August, right?
We are trending downwards, but I do believe that you are correct, and we will find out on September 8th.
Okay, and then also regarding the schools, there are more schools that have applied. Are there any more public schools in the county that have applied, or are we still looking at the two?
We have 2 public school districts that have applied for waiver so far, still.
Okay, all right, thank you. No more questions.
Thank you, Josh. Next up, we're going to Laura Place with Santa Maria Times.
Hi, can you all hear me?
Yes, we can hear you. Thanks, Laura.
Okay, my question is regarding cohort gatherings at schools. I know that some schools are interested now in bringing back students with targeted needs back onto campus, maybe like special education students or those like in vulnerable home situations, etc. And I know that those schools have to notify the county at least if they're going to be doing that. How many schools or school districts have notified the county so far that they're interested in pursuing cohorts?
You know, the guidance on the cohorts is really fresh. It just came out last week. And we did not make it mandatory for them to notify public health if they are intending to open these cohorts, as long as they are abiding by the guidelines that are very clearly outlined in the CDPH guidance form. And we really don't have a clear-cut idea of how many cohorts will be opening up next week. We are in close communication on a daily basis, and we get a lot of questions, and we answer a lot of questions and give advice. So I anticipate that there will be quite a bit of activity.
Okay. And I know that that cohort guidance came out from the state, but is that concerning at all to, I know it's still pretty fresh, but is it concerning to you all at all that a lot of schools could just start having students back on campus without really having their process vetted by the county? You know, it's definitely less comprehensive than the waiver process, but it still results in students being back on campus.
That is correct.
Santa Barbara
However,
County Public Health updating the public on the COVID situation as we head into the Labor Day weekend ahead. 64 new cases of COVID, 224 active cases currently. 39 patients are hospitalized this afternoon, 16 in the ICU. Santa Barbara County's total rate right now, 8,361.
Stay with your news channel for breaking news updates on air and on all your devices.
Right now on your local news channel, live at 5. As the Labor Day weekend begins, so too do the partial closures at Santa Barbara County beaches. But that doesn't mean you can't visit the coast. What you need to